teenagers in the 80s and 90s would watch this material, but would generally not expect that they would ever be featured on the cover of a magazine or on a Hollywood movie. But now with social media, there's additional pressure for teenagers to produce content, not just consume content. And so their bodies are on display more than ever. And I think that this is, more acknowledged in girls than it is in boys.
Welcome back to Shrinking It Down, Mental Health Made Simple. I'm Gene Beresin.
And I'm Khadijah Booth-Watkins.
And we're two child and adolescent psychiatrists at the Clay Center for Young Healthy Minds at the Massachusetts General Hospital. Today, we're going to spend some time on a topic that really doesn't get enough attention: boys, body image, and eating disorders. So despite the stereotype that eating disorders are a female thing, about 1 in 3 people struggling with an eating disorder are male.
And for eating disorder behaviors that don't really meet the clinical level of a disorder, like things like binge eating, laxative abuse, fasting, these behaviors are nearly as common in men as they are in women. So to help us delve into this a little bit more deeply, we're pleased to be joined by Dr. Jason Nagata from the University of California, San Francisco, who is an expert in eating disorders, and particularly with the focus on boys and men. So welcome to the show, Dr. Jason Nagata.
Thank you so much for having me.
So, Dr. Nagata is a pediatrician and an adolescent medicine specialist who cares for hospitalized adolescents and young adults with eating disorders. He's also a researcher, and his lab focuses on eating disorders among boys, men, and the LGBTQ plus community. He also studies health consequences of adolescent and young adult behaviors with the goal of preventing cardiovascular disease and mental illness in later adulthood. So we're all about prevention here at the Clay Center and early intervention. You're really a perfect guest for this because I think what many parents are concerned about with their kids that have eating disorders is, well, first, how to prevent it. And we can get into the various different factors that go into causation. But also, once it starts, about early intervention.
So Jason, before we get into our discussion, is there anything else you'd like our listeners to know about you, about your background? I mean, I'd love to hear about how you got into this field, or do you have any particular areas of interest?
Yeah, thank you so much. I actually did get into this field and background because of one of the first patients that I ever cared for as a medical student. I remember that I was in the adolescent clinic in our eating disorders referral center. And one of the first patients that I followed was a 16-year-old male wrestler. He was referred to the eating disorders clinic by his parents because they were really concerned that he was becoming obsessed with his appearance. He was weighing himself 10 times a day. He would severely fast and restrict food intake in order to make the weight cutoffs that were required by the wrestling team. And in addition to, varsity wrestling practice for 2 or 3 hours a day, he would then spend all of his free time, up to 5 hours extra in the gym on his own weightlifting. And he started having very restrictive diets where he would only consume protein, like protein powder, shakes, and egg whites, but tried to eliminate all fats and carbohydrates. But he was really struggling with this for years, actually. And I think that part of this was masked by sort of normalized behaviors within the wrestling team. But it did get to a point where, it did take over his life. He was obsessed with it. And when he was actually first seen by us in clinic, he did need to be hospitalized because he had had some significant heart and liver complications that required a hospitalization. But I remember as a student, trying to give the best care to this young adolescent, trying to read about guidelines for eating disorders in boys and men and what I could do to help him. And I was actually kind of at a loss because all the guidelines were based on female samples, and they included things like, if you have a loss of periods, then this is what you should do. And even back then, the diagnosis of anorexia nervosa required the loss of menstrual periods, which obviously doesn't apply to boys. And so it was just a big wake-up call for me that there was really a big gap in terms of just general knowledge on how to care for and identify eating disorders in boys and men. And that really directed my research and career for the rest of my training.
With our first impressions, often, our first patients often lead us to where what we do for careers because we're so impressionable, right? Just as human beings. So I know we want to get into eating disorders, but maybe we could start with a closer look at boys and body image, since these are two things that often go hand in hand. And I was reading that in 2002, a national poll of parents and kids ages 8 to 18 found out that in the report, more than two and three parents perceive their teenage sons to be self-conscious about some aspect of their appearance. So these are just parent perceptions, and not the voices of teens, but 2 out of 3 is a lot. So Jason, has that been your experience that boys and girls are both highly self-conscious about their appearance and body image?
Yeah, the study that you cited is very much in line with our understanding of body image. And I just wanted to reiterate that I think people are generally more aware that girls, especially teenage girls, have body image concerns, predominantly with drive for thinness, since that may lead to weight loss goals. But I think that people are relatively less aware that boys actually have body image goals as well. And, you know, we had a similar study looking at data from the Centers for Disease Control, looking at high school students across the US. And we similarly found that unsurprisingly, about 2/3 of teenage girls are actually trying to lose weight actively, unfortunately. But we also found that 2/3 of teenage boys are trying to change their weight actively. But with boys, there's different pressures. About a third of boys were trying to lose weight, but a third of boys were actually trying to bulk up and gain weight. So I think that there's more heterogeneity and like differences in what boys are trying to achieve, but there are still a majority of boys, high school boys, who are actively trying to change their weight concerns. And I do think that teenagers are generally more sensitive to their peer influence and appearance. They're starting to become their own individuals. They may be starting to date and have like romantic feelings. And so there are all these pressures that are actually part of normal development to be more, sensitive and concerned about one's body. And of course, they're going through puberty, so there's many changes that are going on. And this is sort of why the peak age of onset for eating disorders does tend to be in the adolescent and young adult period during this sensitive window.
So, body image is super important, and as you say, it is a normal part of development. And I think that all of our listeners will kind of either young adults or parents will agree. But let me ask you this: how much is influenced by other social forces like the media?
Yeah, I think that the media is one of the big influences in body image. The traditional thought is that the media, peers, and families are the big three sort of socio-cultural influences into body image. And I think that the media has been around for a while, but I do think that one recent development in the last couple of decades has been the advent of social media, because I think social media uniquely combines traditional media with peers, because obviously many peers are posting on social media, and to some extent family members may be posting on social media. But traditionally, if people were consuming media through television or movies or magazines, they generally were living in a read-only environment. Like teenagers in the 80s and 90s and early 2000s would watch this material, but would generally not expect that they would ever be featured on the cover of a magazine or on a Hollywood movie. But now with social media, there's additional pressure for teenagers to produce content, not just consume content. And so their bodies are on display more than ever. And I think that this is, more acknowledged in girls than it is in boys. A lot of the congressional hearings that have been going on recently that have highlighted the impact of social media on body image have really focused on studies that have focused on girls and weight loss and how social media may contribute to weight loss pressures in girls. But the few studies that have actually looked at this in boys have found similar findings. And boys actually do have unique, uh, you know, patterns of use of social media. So the studies that have looked at this have found that actually boys are more likely than girls to allow for public followings. Their selfies are more likely to display their full body with muscles rather than just their face. And a majority of male body image content does depict muscularity and leanness. And the studies that have looked at the impacts of social media consumption and teenage boys and young men have found that more social media consumption or use has been linked with meal skipping, disordered eating, dissatisfaction of one's muscles, and even use of anabolic steroids.
Yeah, one thing about that I think has really been positive is in terms of the media. I mean, we've always talked about the negative impact of the media and the negative impact of particularly social media. But I think, and this perhaps has to do with national trends, um, and with the National Association of Eating Disorders. There's more diversity in terms of body shape and size on television now than there certainly was in the 50s, 60s, and 70s. And I can't help but well, my hypothesis is that all of the research that's been done about the media's influence on body image, from Barbie and Twiggy and super thin models and the like, has had an impact on television production to include a diversity of size, shape, and even in Barbies. I mean, there are toys that have changed. Do you find that to be the case, Jason?
Yeah, I
It's a
do think
it's a
that there
well,
are
go
I
ahead.
think you're right in that there is more acknowledgement of body diversity, and there are even terms like body neutrality and body positivity, and there are even some influencers or celebrities who really, I think, endorse this and are really known for this. So I do think that it has definitely allowed for a more diverse representation in the media overall. But I do think that there still are these immense pressures for most young people, and including those who are influencers and celebrities.
But
Well, yeah,
I think that deliberate diversity that we are seeing is really more apparent in diversity of women and their shapes and their sizes. I don't know that and that I'm not the aficionado of all things TV, but I don't know that I see so much in terms of diversity and what men's bodies look like in film. They always, for the most part, unless it's a quote unquote stereotypical role, they always look pretty, muscular, well defined. Like it's rare that I see a lead role of a man who is supposed to be, handsome, charismatic, be someone that doesn't look like what, that quote unquote ideal is. But I do see it much more when we depict women, whether it's, singers deliberately picking a diverse set of background dancers or
yeah.
backup singers and things like that. But I don't think we're doing a good enough job as it relates to boys and men. There really is this kind of lack of attention and awareness to the challenges that boys and men face. So I guess what should a parent know about how body image ideals differ for boys and men? Like what is the supposed ideal body type for them?
Yeah, thank you for raising that. I think you're absolutely right that when people think about eating disorders, they typically think about weight loss and thinness, which is sort of the feminine ideal body. And that makes sense because a lot of the early research and even the early diagnostic criteria for eating disorders was really more reflective of anorexia nervosa, was on female samples where the body ideal is thin. And so, even when we ask about typical disordered eating behaviors, we think about behaviors like fasting, skipping meals, dieting, or taking laxatives or diuretics or vomiting to lose weight. But we don't think so much about behaviors or goals to gain weight or muscle. And the masculine body ideal is actually big and muscular. So muscle dysmorphia is also known as bigorexia or reverse anorexia, and this occurs when a boy becomes obsessed with the idea that their body build is too small or not muscular enough. And so this may lead to a host of other behaviors that are not characterized or included in some of those typical behaviors we think about disordered eating, like engagement in excessive exercise or overconsumption of protein while cutting carbs and fats, or using muscle building drugs and supplements like anabolic steroids. And so these are all things that I think, need to be more aware of, especially in our boys. And I will say that there is more diversity and heterogeneity in boys. And so while there are boys who are trying to bulk up and gain weight, there definitely are also boys who are trying to lose weight and who can develop anorexia nervosa. So I think there's just a more of a wide spectrum of presentation of eating disorders in boys.
I shared with the group one of our previous podcasts. I remember my son used to watch the old Hulk, Incredible Hulk TV series, and he used to run around like flexing his arms and trying to appear to be muscular. And I think that idea of this is what a man should look like really does start early in terms of what they see and what they hear. So I think that's really important for us to think about and know.
Yeah, absolutely. And just to echo that, even male action figures, so Superman, Batman, Marvel superheroes, studies have shown that actually the muscularity that in male action figures has increased significantly over the last 30 years. And so, if you think about 5 to 10-year-olds who are
really
playing
abnormal.
Yeah, and so I think these pressures do start at a very early age.
Well, it kind of reminds me also of the Barbies of the 1950s. I mean, that was the prototype, kind of a physiological impossibility, like super long legs, like no waist, extraordinarily thin, very long arms, you know. So I guess toys are an influence. But what about some other influences? You mentioned media, and you mentioned, I think it's really interesting that the difference between just passive watching and actually interacting is important. But you also mentioned family. And could you talk a little bit about, or tell us a little bit about what the family influences are, and perhaps certain cultural influences? What kind of families are risky?
Yeah, that's a great question. And I think that, eating disorders are very complex in that they have lots of different potential contributing factors. So there are genetic, biological, and social and environmental factors. So I guess when we think about families, potentially one linkage is through this genetic component. We do know there are genetic studies that have shown there is a genetic component to anorexia nervosa. And so some of these genes can be passed down by families, and there could be more of a predisposition for people who have sort of this already genetic risk. But in addition to that, I do think that there are also environmental and cultural or social pressures that can also be, perpetuated in families. For instance, if there is a emphasis on body image or certain body ideals or pressures for losing weight or gaining weight in certain families. And so, whether or not we as parents think that we have a big influence on our children, actually one of the biggest influence on our children's behaviors is our own behaviors. And so, also having a lot of concern about one's body and, making dietary changes, our children are watching even from a young age. And so I think it's just also important that people are careful about the way that they, comment on other people's bodies or their own children's bodies, because sometimes these can add to pressures. And I think, many people are actually, I think, not poor and like are well intended, but sometimes, especially with a sensitive teenager who might be, have sensitivities to their own body, comments about weight loss um, uh, or things like that can be internalized and then can lead to, to more disordered behaviors. Um, so anyway, I think it's just to say that there's no one clear cause of eating disorders. I think there's a very complex combination of genetics and environmental and social factors. And I will say that other than the stereotype of eating disorders primarily affecting girls and women, which, as I've mentioned, should be, I think we should break that stereotype because we do know that eating disorders can affect people of all genders. I also think that we should, I think there's also potentially a stereotype that eating disorders affect, people from certain cultures or backgrounds. And I also think that there's limited research on eating disorders in other cultures, but I do think that that we are seeing more and more that eating disorders can affect people of all races and ethnicities and cultural backgrounds and sizes and sexual orientations. And so it really can affect diverse populations, and we should also be careful not to have stereotypes about eating disorders across other sort of demographic trends.
Can you speak to maybe the role of the culture of sports in terms of, disordered eating in boys? I think again about my son who is like playing football and he's bulking and he is, trying to, eat more protein, go to the gym more. But I see it being within reason, but I can also see how that can take on a life of its own, kind of sort of what you talked about before. But I think then there might be the other side of that where there might be the pressure to, in an unhealthy way, lose weight to be able to make weight for. Also, I think they do this in football or wrestling. But what is the role of the culture of sports as it relates to boys and eating disordered behavior?
Yeah, that's a great question. I do think that athletes in general are at higher risk for eating disorders and disordered eating. And in boys, we do know that there are a few particular sports that may be of risk. As I mentioned before, sports that have very specific and rigid weight cutoffs, like wrestling or crew, where literally as part of the sport, you have to cut to a certain weight, and you have weigh-ins to make that sort of becomes normalized. And for some people, that can be okay, but for the first patient that I mentioned, having to go through these cycles of extreme weight loss, every so often, did become part of his normal routine, and then it did develop into a full-blown eating disorder. So I think that there's a spectrum, and in general, physical activity, healthy eating are things that we do, encourage in young people in moderation. And as I mentioned, a majority of youth these days are actively trying to gain weight or lose weight or change something about their weight, and not all of them will develop eating disorders, and a vast majority of them won't. But I do think that there's a spectrum of people who are trying to change their eating or exercise behaviors in order to achieve a certain body ideal or a performance ideal in the case of sports. And then it can become a slippery slope where a subset of those people, it does become a preoccupation or an obsession. And to me, where it sort of becomes a disorder or it starts to really cause issues is if it leads to any kind of social or functional impairment, if it's starting to really worsen their quality of life. So in general, sports and physical activity, should be healthful. It should, release endorphins and make somebody feel better about themselves. But for some subset of people, when it really becomes an obsession, they feel like the patients that I take care of, with these issues say that they feel guilty. Any minute that they're not spending working out or eating a certain way, they, feel guilty and they can't stop thinking about it. And it leads to, like if they aren't able to eat meals with their families anymore or with friends because they perceive those meals to be not high enough in protein or too high in fat. And it really then detrimentally affects their social life or their schoolwork or their other work. I think that's when it sort of then tips over into the world of a disorder.
So there was a 2019 peer-reviewed publication, coincidentally from UCSF, that shared that as many as 60% of boys in the U.S. reported purposefully manipulating their diet and striving for greater masculinity. How can a parent or coach or any really caregiver know what we say here at the Clay Center, what are the 3 W's? So like what to look for, when to worry, what to do. And you kind of said some of those things in terms of how we know that it has crossed the line to disordered eating or an eating disorder. But what are some of the, like, what do we do, I guess?
Yeah. So I do think that in terms of the what to look for, as I mentioned, while you can look for, the typical weight loss behaviors, which can affect boys and men. So, extreme dieting or restriction or skipping meals or engagement in vomiting or, diet pills that can lead to weight loss. I think it's also important to look for some of the muscle building behaviors, like excessive exercise or use of steroids or other muscle building drugs or supplements, and also just extreme diet changes to bulk up and gain muscle. I do think that when to worry is when, as I mentioned a little bit earlier, when they're not just behaviors, but they develop into preoccupations or obsessions when they really worsen a young person's quality of life and it impairs their functioning. That's one to worry. And then with regard to some of the muscle building behaviors, even use of anabolic steroids in any context, without a prescription, can be dangerous because they can have really significant effects on one's heart and liver and even growth. And so I think that some of the muscle and performance building drugs are things to worry about, especially in athletes. And then finally, in terms of what to do, I do think that it's if you are able to have a conversation with your child or loved one who you might be having some concerns with, having some open conversations, and also trying to get help, potentially with a pediatrician or primary care provider. And even if they don't have, specialty expertise in eating disorders, they may be able to do some initial assessments and lab tests, and then provide appropriate referrals as needed.
So there was a listener question for you, Jason, on Instagram. Are eating disorders in boys often triggered by internalized anxiety or depression? And we, like for example, we know that, I don't know if the data is still true, but about 50% of girls with anorexia nervosa would have associated major depression and 70%-ish with bulimia. So one question is there an association with other psychiatric conditions or disorders with eating disorders in boys? And are there also differences associated with certain populations, like for example the LGBTQ plus boys or versus heterosexual boys? So how do we? One issue is is associated disorders, and one issue is certain populations that may be at higher risk.
Yeah, thank you to the listener for those questions. I think they're really important questions. And yes, I do think that there is a high co-occurrence of anxiety and depression with eating disorders, including in boys and men. I do think that it is somewhat individualized. And so in some cases, eating disorders can be triggered by anxiety or depression, but in other cases, they can, they can develop on their own right and perhaps later be related to anxiety, depression. So I don't think that there's a clear, one size fits all answer. I think for some people, anxiety, depression could be a trigger, but for others, it's not. And I will say that it is a little bit, it can be a little bit murky in terms of there are even symptoms that overlap. So, for instance, if somebody is severely depressed, one of the side effects or symptoms or core symptoms of that can be like a loss of appetite. And so they may stop eating and that can lead to weight loss. And so then there can be sort of a vicious cycle of, maybe an initial weight loss related to depression that can then, bring on an eating disorder. So I do think that, there's a very complex interplay between some of these mental health conditions, but oftentimes they do co-occur. And then with regard to the second point about certain populations within boys, there is emerging research on sexual and gender minorities like, gay, bisexual, and also transgender young people. And in general, it does seem like within boys, there are higher risks of eating disorders among sexual and gender minority populations. I guess just starting to think about transgender youth, I do think that this is actually the population where there might be the highest rates of body dissatisfaction. If you imagine somebody is born into a body that their gender identity does not agree with, so like the sex that was assigned at birth to them is not in congruence with the identity that they feel with their gender, and then there are all these societal pressures for gender norms like this masculinity, being big and bulky, femininity being thin. You can imagine that could even lead to more body dissatisfaction, which could then lead to an eating disorder. So I do think that transgender youth in particular are at high risk for body dissatisfaction and eating disorders, and then also there have been studies that have looked at gay and bisexual boys and men, and one of the potential mechanisms for that, we talked about peers and the media being a big influence. And we do know that gay bisexual men actually tend to use social media more than their heterosexual peers, and actually tend to post more. And perhaps then there are more pressures for some of these body ideals that are perpetuated through the media for these populations.
So, just getting into some of the consequences and the long-term follow-ups. We know that the number one cause of death in girls and young women in psychiatry in eating disorders is suicide, and particularly during periods of recovery. Now that's if you follow these girls, for a long time, longitudinally. Do we know what the risks are? Is it similar for boys with eating disorders? Is suicide a concern if you follow them long enough?
Yes, unfortunately, eating disorders can be life-threatening in boys and men as well. And although there's less research in boys and men than there are in girls and women, I think the biggest study looking at mortality in male populations from Scandinavia has found that 13% of males with anorexia nervosa will eventually die from that. And so it is, quite a large mortality rate. And so it should be something that's taken very seriously, and why it's important that people get professional help early on. We have also looked at teenagers and young adults who have been hospitalized at UC San Francisco, where I work, and have also found that actually, perhaps because boys are diagnosed later and perhaps have had to suffer, with the illness for a longer period of time before they actually get into care, that actually the presentation of at least the medical complications of eating disorders in boys tend to be actually more severe when they are first seen in care, whether it's in the clinic or in the hospital. And so they tend to actually have like more significant heart complications, more significant liver complications, and higher rates of anemia, so a low blood count than girls when they are seen in care.
And you mentioned earlier that there's so much heterogeneity or so much diversity in how boys present with respect to eating disorders. Can you share what a parent might expect in terms of treatment that their child might receive if they have an eating disorder?
Yes, absolutely. I think that ideally, because eating disorders are so complex and have a mental health and physical health and nutrition components, ideally an interdisciplinary team that has specialties across mental health and medical management and nutrition is ideal. So having a nutritionist, physician, like a medical provider, and a mental health provider, whether it's a therapist or a social worker, to address all of these different aspects of an eating disorder is ideal. But I also realize that these tend to be centered in academic centers, and so they may be hard to reach for some people, or particularly in rural areas. And I do think that with the advent of telehealth, especially since the pandemic, there has been a little bit more access in terms of being able to do some virtual visits and virtual therapy. But I think that there has been also just a large rise in eating disorders since the pandemic, and not enough providers, unfortunately, with specialty experience. And so I do know that many people have had to wait quite a long time to get into care.
And what's the outcome of treatment? I mean, I know it's a general question, but in my experience, and whenever I see a parent or parents or families, I have to work with them to help them see that this is a marathon and not a sprint in most cases. What do you see? What advice do you give for parents and, to help them kind of see the bigger picture?
Yeah, I think that's a really important question and point, and yeah, definitely not a one size fits all answer. I think that for youth or minors who are still living at home, the first line treatment is really family-based treatment or family-based therapy. For young adults who maybe are no longer living at home and are more independent, then maybe cognitive behavior is the the behavioral therapy is the first line with more individualized care. Um, and I will say that, there is a large spectrum. And as you said, it's in most cases, it's really not going to be a quick fix. It's, going to require a lot of continued engagement in, mental health, medical care, and nutritional counseling. And so I will say that, there's a big variety in terms of outcomes. Some people can make a full recovery. Some people do struggle for, from decades or for the rest of their life. And unfortunately, as I mentioned, a tenth or even a little bit more than a tenth of people will ultimately die from the illness. And so it is very, important that they get care. But I do think that the things that are linked with better outcomes are, early diagnosis and treatment. So the earlier you are able to get into care and engage in therapy, that, increases one's risk for being able to make a full recovery. And then also just continued engagement in care. And so I do think that part of the struggle is that sometimes people, sort of complete care or do not, do a full treatment course because, they feel like, oh, I'm sort of better, and they don't continue, or they don't follow up with care. And so I do think that it's also important that, that young people, even if they feel like they're improved a little bit, really do continue to follow up with their professional team to support them, throughout the entire journey.
I mean, I love that you mentioned, or I love that, Gene, that you asked about outcomes and that you mentioned the early intervention, because this is why it is so important for us to be having this very necessary conversation so that parents know, what are the early signs of disordered eating in their their young children or their boys, and that it can look different for boys than it does for girls. So I do think this is so important for us to be having this conversation, and for parents to be and caregivers to be having this conversation at home as well.
So just looking at the time, to wrap up, let me just ask, because we're using at the Clay Center, we're using the arts and media to promote education and conversation about issues. Is there a book or a movie or a TV show that you can think of, Jason, that gets it right? That, when it comes to positive body image for teens, or appropriately responding to negative body image or eating behaviors, or that helps families see what's a healthy way to kind of like help their kids be content with their body. I mean, since some of it, is there anything that you would recommend?
Yeah, that's a really great question. And I will say that one of my colleagues, Charlotte Markey, did a couple of years ago publish a book that's really geared towards teenage boys, and it's called Being You, the Body Image Book for Boys. And it's really written to a teen audience. So it's really, not for parents, it's for teenagers and young people themselves. But it specifically raises some of these issues that boys might consider, like we mentioned, considerations for athletes, or some of the muscle building concerns that that may arise as teenage boys are going through puberty. And so I do think that that's a good resource that's really age appropriate and developmentally appropriate for teenage boys. And for parents and caregivers who want to learn more, the National Eating Disorders Association does have specific content about eating disorders in boys and men and muscle dysmorphia in their resources page.
Well, thank you again, Jason, for the time today, all of this amazing information that you share with us. We've really enjoyed having you.
And for those of you at home, if you like what you've heard today, consider leaving us a review. And we hope that our conversation will help you have yours. I'm Gene Beresin.
And I'm Khadijah Booth Watkins. Until next time.
Yeah, I think that one of the things that I refer to when I talk about the Marvel superheroes is, if you think about the original Batman and Robin, like Adam West, from like many decades ago, they had kind of normal-ish bodies. But if you look at Batman now, they're really bulky. Or you're talking about the Incredible Hulk, like they've become quite a bit more muscular than they were, several decades ago.